Hi, everyone. I'm Brandon Baker, Vice President of Development at RAND. Thank you for joining us for today's RAND 2020 event. We're grateful that you've tuned in to learn more about how RAND is tackling the effects of COVID-19 on American lives and livelihoods, from how people are paying their bills to the pandemic's effects on health and well-being. Senior economist Shanthi Nataraj will talk about RAND's findings using data from our unique RAND American Life panel, a nationally representative panel of thousands of participants who are regularly interviewed by RAND. After a 20-minute presentation, we'll take questions for 20 minutes. You can use the question feature on your screen to submit a question at any time during the presentation. Shanthi is the director of RAND's Labor and Workforce Development Program. Her research focuses on labor markets, firm productivity, and job quality. She has led studies examining how workers' education and work experiences affected their transitions to jobs and the value workers place on specific job benefits. She also completed a study examining the integration of Syrian refugees into labor markets in Turkey, Jordan, and Lebanon, as well as a study of how the Deepwater Horizon oil spill impacted employment in the Gulf states' fisheries and tourism industries. Shanthi, welcome.
Thank you, Brandon. I'm honored to have the chance to present some of our research on the impacts of the COVID-19 pandemic on Americans' lives and their livelihoods. On March 19th, 2020, Gavin Newsom became the first governor to order Americans to stay at home. Over the next 2 weeks, most other states followed, with similar measures, shutting down most non-essential businesses, closing schools, banning people from gathering in groups, and dramatically and fundamentally altering nearly every aspect of our daily lives. There was virtually no aspect of our lives that wasn't quickly interrupted. Tens of millions of Americans filed for unemployment benefits, overwhelming state unemployment insurance systems throughout the country, and driving the unemployment rate from 3.5% in February to a peak of nearly 15% in April. Tens of millions of Americans wondered how they were going to pay their rent in April, and in many cases, how they were going to afford to eat. Tens of millions of small business owners wondered how they were going to stay afloat, when they'd be allowed to reopen, and if at that point, they'd even have the ability to do so. 55 million school children were no longer able to get an in-person education. And for the millions of students who lacked reliable internet access, could often get no education at all. These initial orders were created at a time of grave uncertainties about how the virus spreads, what its impacts are, and whether our nation's healthcare system would be overwhelmed by a tidal wave of patients who needed hospital beds, ICU access, and ventilators. And while we still face major uncertainties about the virus's spread and its impacts, and certain areas still struggle to ensure that they have a sufficient number of hospital and ICU beds, in the months following the stay-at-home orders, we've learned a lot about the measures that we can take to mitigate the spread and the impacts of the coronavirus. That learning has come not just from the immense effort at scientific research that's taken place, but also from learning by doing. Both states that took a relatively cautious approach, shutting down early and starting to reopen relatively late, like California, and states that took a more aggressive attitude towards reopening, like Texas, have had to alter and change their policies multiple times as case counts changed, as the public's willingness to put up with different measures to stop the pandemic evolved, and as we learned more about the virus, as well as the economic, health, and emotional impacts of the policies aimed at combating it. As governments, businesses, and the public continue to grapple with ways to craft effective, sustainable policies that can help to control the spread of the virus, one critically important input is publicly available, up-to-date, high-quality information on how Americans are being affected across a wide variety of areas. Today, I'll share one way that RAND has been working to provide this kind of information to inform policy decisions using the American Life Panel, or ALP. You've probably seen that a lot of organizations have made efforts to collect data during the pandemic. The ALP is unique for a variety of reasons. It's a nationally representative panel that covers several thousand respondents from across the US. We provide technology and internet access to those who need it, so we can ensure that we represent Americans from all walks of life. The ALP also has a relatively high retention rate. That is, people who are asked to respond to multiple survey waves are generally good at doing so. We can typically track about 90% of survey respondents from one wave to the next. That's critically important because it helps us to distinguish how people's individual reactions and responses are changing over time. The panel's been in use since 2006, and over 550 surveys have been conducted on it. This means that we can not only link our current survey results with the results of other ongoing surveys that are fielded on the ALP at the same time, but we can also link them with older surveys over the last 15 years and present a comprehensive picture of how Americans' lives have changed, not just in the recent past, but over a long period of time. And all of the data from ALP surveys are made publicly available after a short embargo period, so other researchers and interested members of the public can analyze the data themselves. Over the past 6 months, RAND researchers have conducted over a dozen surveys related to the COVID-19 pandemic and its impacts using the ALP. I'm going to focus largely today on a survey that we conducted during the first week of May, which captured a broad range of impacts, from impacts on Americans' physical and mental health to the impacts on their employment, their financial well-being, their children's schooling, and more. I'll also present some preliminary findings from follow-up waves conducted with the same group of Americans in June and in August. Now, as we all know, the pandemic and the policies aimed at controlling it affected nearly every aspect of our lives. Unsurprisingly, given that a key aim of the stay-at-home orders was to limit the number of physical in-person interactions that we had, over half of Americans said that the pandemic had very much or totally disrupted their ability to interact with their friends. About 25% felt that the pandemic had similarly very much or totally disrupted their ability to do their usual task or chores. Another 10 to 20% said that they had trouble taking care of their daily chores or being able to take care of others who depended on them. And fully 1/3 of Americans said that the pandemic very much or totally stopped them from planning for the future or imagining a return to normal life. Strikingly, by the time of our most recent survey wave conducted in August, very little had changed. Perhaps most strikingly, it remained the fact that over 1/3 of Americans said that they were unable to think about planning for the future or returning to normal life. Outside of the health impacts, one of the most immediate and obviously devastating impacts of the pandemic has been how it's affected Americans' lives and their livelihoods. Let me first talk about the health impacts and then turn to some of those employment and other impacts. The pandemic and the related stay-at-home orders were intended to avert a health crisis. But one of the things that's emerged over the last several months, something that's been posited by the head of the Mayo Clinic and many other health professionals, is that we can't let fear of the coronavirus stop us from taking care of the treatment of other diseases. In May, we found that about 40% of Americans were being treated for a chronic health condition such as heart disease, lung disease, or diabetes prior to the pandemic. Among those Americans, fully 30% reported that their treatment had been disrupted, canceled, or delayed due to the pandemic. And similarly, about 1/4 of those who were previously being treated for a substance abuse or a mental or emotional health problem similarly reported that their treatment had been disrupted, canceled, or delayed. As I said, outside the health impacts, the most obvious consequences of the pandemic have been economic, the impact on people's jobs and their livelihoods. In May, we found that 17% of Americans, that's over nearly 1 in 5, who were working in February, were no longer working in those jobs. The overwhelming majority of those who lost their jobs said that they'd been laid off, furloughed, or put on unpaid leave by their employers, or were no longer able to do their jobs or run their businesses because of the coronavirus. Some other Americans were not able to work because of other reasons related to the pandemic. For example, about 10% said they were at high risk for coronavirus complications. Another 10% were caring for children who no longer had access to their usual childcare or schooling options. And I'll return to this in a few minutes. One of the most striking aspects of this pandemic has been the unequal nature of the consequences. And the employment aspects really highlight those disparities. Among people who were able to telecommute to their jobs in February, only 6% of those had lost their jobs by May. These people typically worked in relatively highly skilled, high-wage jobs such as computer science, finance, law, or engineering. In contrast, among those who could not telecommute to their jobs in February, typically those in lower wage, lower skilled jobs like construction, maintenance, and transportation, fully 25% had lost their jobs by May. What about those workers who kept their jobs? How have they fared? Well, a majority of workers who remained on the job told us that they had kept the same earnings and hours as they had prior to the pandemic. But a substantial share, 25 to 30%, indicated that they had seen a drop in hours and in earnings. And an even larger share, nearly 40%, reported that they were less productive during the first week of May than they had been in February. Another important aspect of the disparity of the pandemic's impacts has been how the various policy effects have impacted men and women differently. The downturn has sometimes been called a she-cession, that is, a recession that affects women more than it affects men. Many of the hardest hit industries, like leisure and hospitality, are disproportionately female. And in fact, in our survey in May, we found that 18% of women, compared with 15% of men, had lost their jobs. The school shutdowns have also played an important role in how the pandemic's impacts have differed by gender. As I'll discuss in more detail a little bit later, the vast majority of parents have reported that they're spending far more time helping their children with childcare and with schooling since the start of the pandemic. In August, when we asked working men and women who had children in the house who was taking care of those children during normal work hours, we found that about 2/3 of both men and women said that they played a role in such childcare. We also found, though, that 35% of these women did not get any help from a spouse or partner in their childcare, compared with 18% of men. And consistent with this difference, we also found that women were more likely than men to say that they were working fewer hours and were less productive than they had been prior to the start of the pandemic. In other words, mothers, and working mothers in particular, are bearing a lot of the brunt of the increased childcare and homeschooling responsibilities, with negative impacts on their employment outcomes. How have workers continued to fare as the pandemic has dragged on over the past 6 months? We've conducted 2 additional waves of surveys of the workers who were on the job in February to look at how their livelihoods have evolved over the past 6 months. There's been an ongoing debate about the likely shape of this particular recession. Will it be V-shaped as workers quickly return to their jobs and the economy recovers? Will it be more like an L as people remain out of work for a long time? Will it be something in between? We found that by June, there was some evidence that employers had started to recall a decent share of their workforces. In fact, 1 out of 3 workers who reported that they lost their jobs by May had been recalled to those jobs by June. However, at the same time, 1 out of 20 workers who had not lost their jobs by May were no longer working by June. It's important to note that these results are based on a relatively small number of people, so they're not precisely estimated. But overall, our findings suggest that despite some improvement in labor market conditions, a majority of Americans who lost their jobs following the start of the pandemic are still not back at work. By August, we saw some continued improvement, but even by then, 1 out of 10 Americans who were working in February were no longer on the job. Taken together, these results suggest that the impacts on the labor market are going to take a long time to recover. Now, given these employment impacts, it's unsurprising then that we found that in May, 1/3 of households said they'd lost income since the start of the pandemic. And that was pretty evenly distributed across households across the income distribution. But importantly, the disparate consequences of the pandemic become clear here as well. About 1/3 of Americans overall reported that they were having difficulty paying their bills. If we look by income distribution, we find that this was disproportionately affecting low-income households. In fact, over half of low-income households said that they were having such difficulties. These problems are also more prevalent among Black and Hispanic households, reflecting the higher prevalence of low-income households among these communities. In fact, 40% of Black Americans and nearly 50% of Hispanic Americans reported that they were having difficulty paying their bills. How are households that were struggling to make ends meet actually managing to pay those bills or otherwise coping? Well, across the income distribution, we found that households turned first to cash resources. Other than those in the lowest income group, who likely didn't have many personal savings to start with, households consistently reported that the first thing they were doing was turning to the cash in their checking and savings accounts. The stimulus payments were also a lifeline. 80% of those who were having difficulty paying their bills reported that they had or planned to use their stimulus payments to meet part of their expenses. But beyond this immediate use of cash or stimulus payments, the methods of coping differed a lot by income. High-income households tended to rely on existing assets, often saying that they would put the expenses on a credit card but plan to pay off that credit card by the end of the month. Middle-income households tended to rely on sources of formal credit, for example, putting the expense on a credit card and planning to pay it off over time, taking out a bank loan or a payday loan. Low-income households had few choices. They reported borrowing from friends and family, selling their possessions, or simply being unable to meet their expenses. What about the mortgage relief and eviction moratoria that were imposed in various parts of the country at various times to provide some relief from rent and mortgage payments? While not as heavily cited as the stimulus payments, we did find that about 20% of respondents said that they planned to ask their landlord or their mortgage provider for an extension. In the August wave of the survey, we once again asked respondents whether they were facing any difficulties in meeting their expenses. As I mentioned earlier, the employment situation had improved somewhat by this time. However, the increase in unemployment benefits had run out at this point, and many households had likely already spent much of the stimulus checks that they'd received. In addition, households that had some personal savings may have run through much of those savings by this point. And consistent with that, we found that by August, the number of households reporting difficulties paying bills had increased to 34% overall from 28% in May. In fact, 63% of low-income households, compared with 52% in May, reported such challenges. For those who attended the last RAND 2020 session, you heard my colleague Laura Hamilton talk about a unique nationally representative survey of teachers and principals, discussing how schools had handled the abrupt shift to remote learning in the spring, and what they were planning to do to tackle remote learning, hybrid learning, or some other form in the fall. We also asked hundreds of parents on the ALP about their experiences and challenges with remote learning. About 2/3 of parents with children below the age of 12 reported that they were spending much more time on childcare and on helping their child with learning activities after the pandemic began. About 25% of parents of teenagers also reported the same. The number one thing that parents said that they desperately needed to help their children was simply more time in their own schedules. Beyond that, they also reported needs for a lot of other resources, ranging from instructional materials to guidance on how to help their children's social and emotional needs, to more rigorous academic supports, to more physical space in their homes where their children could work. Here again, the disparities of the pandemic are acute. Parents who reported financial difficulties were also most likely to report needing each and every one of these resources. These are just some of the key findings from our recent studies. We continue to collect and analyze and disseminate our results. Of course, for these data to be useful, we have to get them into the hands of policymakers and businesses and communities. So to that end, we've made all of our data publicly available on RAND.org, RAND's website. Now, of course, most policymakers don't have time to parse through dozens of data tables, and they want to know what the key takeaways from our data are that they should be using to craft policy. To help with that, we've developed a number of short, readable online reports summarizing some of these critical findings. RAND researchers are also working with RAND's Office of External Affairs to get our results out through commentaries, social media, media interviews, and more. We've also shared our findings with the research community by posting our survey instrument on the National Institute for Health's public database of disaster-related surveys. And as with all ALP surveys, we'll be sharing the raw data as well. So what's next for our efforts? We're continuing to collect a series of surveys on Americans who were working in February to examine whether they're recalled to their old jobs, whether they start new businesses, or how else their livelihoods change. We'll also link together the work that I've described with other surveys conducted using the ALP, examining Americans' perceptions of risk, their experiences with substance abuse, and more. Doing so will help us to provide policymakers with a more comprehensive picture of how the pandemic is affecting Americans' lives. And we'll draw on the long-standing nature of the ALP to examine longer-term changes in the nature of work. One of the most important questions that's emerged from the abrupt shift to telecommuting in February is this the new normal? In addition, there have been calls for Americans to have access to different and more types of benefits, including paid sick leave, so workers who are sick don't feel obligated to come to work, thus endangering others. We're tracking the access that Americans have to these benefits during the pandemic, and we'll also tie in our results with nationally representative surveys of working conditions from 2015 to 2018 to examine how the nature of work has evolved during this time. Thank you again for the chance to present some of our findings. For anyone who's interested, all of our results are available on RAND's website, and I welcome any questions that you have now.
Shanthi, thank you so much for this great work. Looking back over the last 6 months since the shutdown, COVID-19 has impacted us all in such different ways. I've had friends and family who have contracted the virus. I've had close friends who have lost their jobs. And my dad, a small business owner in Alabama, has had to keep his farm supply store afloat. So I'm so grateful for the work that you and the other researchers at RAND are doing to help inform our citizens and our decision makers to help get us through this very difficult time. Strengthening and safeguarding our communities and improving the lives of the individuals within them is a critical priority of our Tomorrow Demands Today campaign. I encourage you to learn more at campaign.rand.org. Now, let's get to some of these questions. Shanthi, so Donna Farley actually asked, you talked a little bit about, how we produce our results on our website, but she wanted to know, how are these results being shared with policy decision makers, maybe directly with state, local, and national decision makers? And, where do they differ from existing measures being reported on in the media?
That's a great question. So we are using a variety of different ways to get these measures into the hands of policymakers. We've got connections locally through RAND's Santa Monica and Pittsburgh offices in particular with some local policymakers and other decision makers. And we've been taking the opportunity of those close connections to share these results with them to help their policy making. On a broader level, these types of results are informing some of the modeling efforts that RAND has been doing. For example, we've developed a tool at RAND that helps policymakers to see what happens to both epidemiological, public health results, as well as economic conditions when we say toggle on and off certain types of policies. And so we're getting those types of results into the hands of, say, state level policymakers as well. And then finally, working with RAND's Office of External Affairs, we're also frequently meeting with staffers at various congressional offices and sharing results with policymakers who are interested in finding out how these are affecting Americans' lives. In terms of how our results are different from others, I would say that we're not necessarily finding results that sort of come up with diametrically different results than anything else you might have read about in the media. I think the key thing about the American Life Panel surveys is that we are continuing to track Americans not just over a broad variety of areas, but over time as well. So, for example, while certain surveys might be focused specifically on health outcomes or people's preferences for telehealth, others might be most focused on people's employment outcomes, yet others might be focused on people's perceptions about the virus and their belief in, what works or doesn't work for mitigating its impacts. We're actually able to tie all of those things together and look at the extent to which some of those factors may actually be affecting others.
Thank you for that. Let's talk a bit about how let's go back and talk a little bit about how this is really impacting the economy and workloads. Harper asked, we've been seeing more and more temporary layoffs becoming permanent. Will this trend continue, and who is most affected?
Yeah, that's a great question. When the shutdowns were first announced, it really was in the public sort of stage framed as this is a temporary effort that we're doing, may just last a few weeks, and we'll be able to quickly stamp out the virus and then restart the economy. And unfortunately, what we've seen is that simply has not been the case. In fact, if you look at some of the employment numbers, what you see is that at the start of the shutdown, there were more people out of work who reported being on temporary layoff and who expected to be recalled to their jobs than there were people who were on permanent layoff. Of course, we have seen several million people who were on temporary layoff recalled to their jobs. But at the same time, and I think quite disturbingly, about every month, we've seen about 2 million people who were on temporary layoff transition into permanent layoff. And we've also seen 1 to 2 million people every month simply leave the labor force for a variety of different reasons. And so I think that is very much a trend that is continuing. We are starting to see more of these temporary layoffs turn into permanent ones. In terms of who's likely to be most affected, I think we can look at this in a couple of different ways. If we think about which industries are most likely to be affected for the longest periods of time, leisure and hospitality simply rises to the top of that list. That's, services including restaurants and hotels, and also entertainment, for example. And the reason is simply because of the nature of the services that they're providing. We're seeing more and more consumer tracking surveys suggesting that people are getting more comfortable dining at restaurants, especially outdoors, perhaps staying in hotels, but that the majority of Americans are still not comfortable with flying or with attending large in-person events. And so, that industry is likely to be one of the hardest hit for the longest periods of time. I think the other aspect of who's likely to be the most affected is really something I alluded to talking about our financial well-being results, which is we're really seeing that it's the households with low incomes that are struggling the most to make it through this long period where there's just very little demand, very few new jobs, and very few options for them to simply get through this period.
Thanks, Shanthi. Before we got started today, you and I were discussing the workforce and how it's changed, and and productivity has changed, obviously, because many of us are working from home. Our friend Jim Thompson actually noticed on one of your charts that there's a substantial portion that says that the workforce is more productive. So can you explain a little bit more about how that might be the case now that we're working from home and not necessarily having to do commutes and that sort of thing?
So that's actually one of the, as I was saying, we are hoping to track people who are working over time to identify exactly these types of changes and whether this shift to telecommuting is something that may be likely to affect the way we work in the long run. As you note, some people did actually say they were more productive, and we don't have an exact reason for that yet, but we do think some of it has to do with they don't have to commute anymore. Perhaps some of their other social obligations have fallen off, and so they're able to spend more time on work, which has its pros and cons as well. But I think that is something that employers throughout the country are currently grappling with. We are seeing some employers announce, for example, that for the next year, all their employees will continue to work from home. We're seeing others who are choosing instead to recall their employees as quickly as possible because they're afraid that they simply can't monitor productivity when their workforce is remote. I think that that's a bit of a challenge to discern at this time. Obviously, we all faced a number of different changes in our lives, not just telecommuting in February. For example, I have 2 kids at home, and so my productivity in March was likely very different, not just because I was working from home, but because I had 2 kids who were also trying to learn from home. And so another thing we're trying to do is, with these ongoing surveys, is try to tease out these different factors and how much we might actually be able to see this continued boost in productivity if telecommuting continues.
Well, thank you. So you mentioned a new term today, which was she session. And I wanted to ask, we have a question here, with the burden of childcare and schooling during the pandemic falling disproportionately on mothers and women, is there concern that there will be long-lasting effects on women's advancement in the workplace?
Yes, that is very much a serious concern. So out of the Americans who were working in February, about 1 in 3 of them had a child under the age of 18. And if you look at families where both parents were working, you had about 15 million of those families. You had another 8 million families who were single parent families where that parent was working. And that's really where a lot of the burden and the sort of discord between employment needs and childcare needs are really coming to bear. In our survey and in others, women are consistently reporting that even when they and their spouse both work, they're the ones sharing or taking the majority of the burden of that increased childcare and homeschooling. And that's likely, unfortunately, to set women's progress in the labor market back for many years to come. And I think there's a couple of things we can think about there, both in the short term and the long term. For example, my colleagues who work on schooling and education issues have made an argument for thinking creatively about how we can get kids back to their education, not just thinking about how to put them back in a traditional classroom, but how might we use outdoor spaces? If older teachers can't come back to the classroom, might we be able to have young, healthy Americans simply supervise children's online learning so that they can continue to get an education and their parents can continue to work? And I think a lot of those solutions may help women get back to work more quickly and not have as many negative impacts as they've had so far. And then in the longer term, I think we are going to need to offer some very important pieces of retraining to help women who've lost their jobs or have just not been as productive or not been made as much advancement as they could have, retrain, retool going forward. And perhaps with a special emphasis on helping small business owners and entrepreneurs, and perhaps female entrepreneurs included.
No, that's great. We've all had our eyes on a vaccine since March, honestly, and as we seem to feel like we're getting closer and closer, there's a question here about how that might impact the likelihood of going back to normal. So how would the implementation of COVID vaccine impact the likelihood of going back to a normal way of life, especially in terms of the economy?
I think it's becoming clear that even if we get a vaccine tomorrow, this is not going to change things overnight, simply because of the logistics of having to roll out the vaccinations, ensure we get them to all the right people, and trace how all of that is happening. But I think going forward, as we get to a point where we can start to return to what we call a normal life, there are still going to be a couple of really important things we need to think about. One is, as we've discussed, certain industries like leisure and hospitality are simply unlikely to come back very quickly. It's, to some extent, there's an argument that people may have this pent-up desire to go out and be in a lot of large events, and that may be true in the longer term. But certainly, as the vaccine is being rolled out, as not everyone has it, and people, especially vulnerable groups, are still understandably concerned, it's unlikely that that industry is going to be back on its feet very quickly. Importantly, not just that industry, but others are going to face the challenge that even if the consumer demand comes back right away, their workers have been disengaged for a long time. Not only that, but we've seen a number of small businesses that may have been unable to stay afloat for the past 6 months, and helping them to restart is going to take a lot of financing, a lot of work, and a lot of, I think, concerted policy effort to get us back to anything close to a new normal.
No, so you just mentioned a bit about the differences in expenses during COVID, but can you go a little bit deeper in that? We have a question here. Do you have information if people or families are spending less or more due to COVID? So, for example, you did talk about leisure and travel, but not having to pay for childcare or clothes or transportation expenses. How does that affect the economy one way or the other?
Yeah, so we did see at the start of the pandemic a sharp drop in consumer spending. I believe the estimate was nearly 15% in April, and then we've seen quite a bit of a rebound since then. But one of the really different things about this particular recession compared with prior ones is just how consumer spending patterns have changed. In a typical recession, what we'll see is that consumers slowly start to spend more on services, and then it's not until they're really close to recovery that they spend more on large purchases like durable goods. We're seeing something almost exactly the opposite in this recession. As I said, people are continuing to not spend a lot of money on travel services, on restaurants, on things like haircuts and other services that require physical proximity. Instead, we're seeing a large jump in purchases on durable goods. So transportation is a great example. People aren't taking public transit anymore, but that also means the people that we're seeing who are going back to work are often purchasing a car so they can now drive, be a single commuter going to that job. And so we've seen a leap in purchases of cars. And similarly, we're seeing a jump in purchases of a number of home appliances like refrigerators as people spend more time in the home. And so I think there's very little precedent for seeing this kind of recovery, and I think it makes it difficult to predict, how long that increase in spending on durable goods is really going to continue.
Thanks. I do want to get into the American Life panel in just a second because I'm very fascinated with our interviewing thousands of individuals to help us out with this kind of information. But I do want to ask one more question that seems to be coming up. And Jamie C. Just asked, with the coin shortage and with people using less cash in general, how has the pandemic disproportionately affected workers who get paid in cash? Are you finding that people that formerly used cash have now had to switch to other forms of payment?
Yeah, so the spending, the use of cash and being paid in cash is not something that we specifically looked at in our surveys. However, you are right that shift away from cash, I think, affects certain segments of people in two very important ways. First is that you have the fact that a lot of people who are being paid in cash were being paid under the table, right? And so when the initial shutdown happened, a lot of them were simply not eligible for unemployment benefits or any other sort of assistance simply because there wasn't a record of them being employees in the first place. I think domestic workers is one of the most clear cases of this being the case. And so it's been a serious struggle, I think, for a lot of those workers to actually make it through financially. And the other aspect, of course, is even people who are being paid, legally, but paid in cash, or simply don't have access to formal banking systems, may not be able to actually go out and purchase the things that they need to now that stores are no longer taking cash. Frankly, in the long term, we're probably moving closer to a world or a cashless economy in general. So this has really accelerated that shift. But I think to make sure that we aren't leaving behind people who don't have access to that kind of banking, we really need to be using, positive efforts to get everybody into a situation where they have access to non-cash ways of spending money. And that's actually some place where we can learn a lot from efforts that have happened with respect to mobile banking, for example, payments through cell phones in developing countries that have faced a similar challenge.
Great, so let's turn our attention now to the actual American Life panel. We've had a lot of questions from Leonard, Keisha, Kip, and a few others. So how does one become an American Life panel respondent? And of the thousands of respondents, how are they selected for the various surveys?
Yeah, we actually often have people reach out to us and say, hey, can I be a respondent on the American Life panel? And unfortunately, we have to tell those people, sorry, that's not how it works. Because our goal is to make this a nationally representative survey, we use a couple of different methods to recruit people. We use random digit dialing, so through phones, and we also use random address sampling, so physical, mailing addresses. And then what we do is once we've taken a random sample from those types of sources, we let people know a little bit about the panel, invite them to join, ask them if they want more information. And then if they want to join, if they tell us they don't have either internet access or access to technology, we'll provide that for them. Now, in terms of actually selecting people to answer specific surveys, in many cases, for example, in the survey that I just presented to you, we wanted to get a representative survey of all Americans. And so we simply opened it up to a sample of all panelists, and we shut down the responses when we had enough. And then to the extent the people who responded weren't exactly representative of the nation as a whole, we used the current population survey to reweight those estimates to make them representative. Of course, there's other surveys, for example, our ongoing work on people who are working, or for example, other RAND research on, say, older Americans, where we will actually target a subset of the ALP population and invite specifically those people to respond.
Perfect. Well, we have time for one last question, and I'm going to do a dual question. One is from Kip from Puerto Rico, actually, and then I have a follow-on question for it. He'd like to know what RAND predicts regarding the duration of the pandemic, but most specifically the subsequent consequences on the economic fallout. And then I would also love it if you could just give us a glimpse of some of the things you're going to be working on in this area in the next few months and sort of what we can look forward to from your work.
Absolutely. First of all, I'm an economist, so I guess we are notoriously bad at making predictions. So I would not even want to try to make a prediction for exactly how long this pandemic and the economic consequences are going to last. What I think is pretty clear from everything that we're learning so far is that no matter how long this lasts, no matter how deep the recession is, it is going to have an unequal impact, hurting certain groups tremendously. And I think the groups that are being hurt the most are low-income American households, those without savings to help them get through, those who are let go from industries that aren't going to recover soon. School children in particular, the ones that live in areas that simply don't have access to schooling and are likely to miss an entire year of education. So I think those are really the consequences that are clearly emerging from this, no matter what happens, and where we need to really focus our policy efforts to help those people improve their lives after this. In terms of where we're going from here, I'll say a couple of things. So one of the projects I'm really excited about is, as I said, we are tracking people who were working in February. We want to know how are their employment prospects changing, not just their actual jobs, but their perceptions about those jobs. So for example, when we talk to people in May, we ask them, if you're still working, how likely is it that you're going to be in this job in 30 days? And about 10% of people said there was only a 50-50 chance they'd still be in that job the next month. And so I think that kind of sentiment that you can get at is really important to track. And then looking at how that relates to their sort of worry about their own financial well-being, their mental health impacts, we're going to be looking at all of that. And I'm really excited to be able to use the American Life panel to do that kind of work going forward.
Shanthi, thank you again so much. Thank you all for participating today. Our next RAND remote event on September 25th will address election safety. Stay tuned for more information and for your invitation. Until then, Be well, and feel free to reach out to us at randremote@rand.org.